Is your child snoring or mouth breathing in the night? Probably it could be adenoids. So what is this adenoids? So adenoids is a normal tissue which is there in every other child who is born. For some children, because of some reason, it might be bigger in size. Hi, Dr. Manasa, consultant ENT surgeon from Dr. Manasa Speciality ENT Center, Rajarajeshwari Nagar. Today we'll talk about a very common symptom of pediatric ear, nose, throat problems, that is adenoids. So we'll divide this into three parts. Basically, what is an adenoid and what are the symptoms if the child has an adenoid hypertrophy and how is it usually dealt with. So coming to what is adenoids. Adenoid is present in every other child who is born. It is a normal lymphoid tissue which is present behind the nose. That is, where both the nostrils become into a single cavity, the roof of it has what is called as adenoids. So this adenoid is usually helpful in children below 3 years of age, in which it provides immunity to the child. The next question is, what happens if the adenoid increases in size, or what we call in medical terms as adenoid hypertrophy? So usually the child will have any or more of the following symptoms, that is nose block, snoring, mouth breathing, repeated upper respiratory infections which can be symptomatically as running nose, cough, cold, fever, and repeated ear infections and ear pain. Adenoids can also cause what is called as protrusion of the teeth and changes in the facial morphology. The next question is, if there is adenoid hypertrophy, is surgery an absolute necessary? So to answer this question, we'll divide the management of adenoids into two parts. The first one being medical management and the second one being surgical management. When a child comes with symptoms related to adenoid hypertrophy or repeated adenoiditis, what we call as recurrent adenoiditis, we put the patient on certain sprays and medications in order to see how the child responds to the medications. So it is an attempt to shrink the size of the adenoids with help of medications. If the child doesn't respond to any of these medications and is having difficulty in breathing persistently with mouth breathing and snoring, then that child becomes a candidate for surgical correction. Surgical correction is advanced nowadays with endoscopic minimal access nasal surgery, where it is done through the natural orifice of the nose. It is a scarless surgery, it is relatively painless, and the recovery period is hardly 1 or 2 days with 1 day admission in the hospital. So the child is ready to get back to school in about 2 to 3 days with full-fledged health. So if the child is suffering with any of the symptoms related to adenoid hypertrophy or repeated adenoiditis, please do visit our center, Dr. Manasa Speciality ENT Center, Rajarajeshwari Nagar. Thank you.